Question 31. Jared is experiencing an acute episode of ulcerative colitis. Which is priority for this patient? A. Replace lost fluid and sodium. B. Monitor for increased serum glucose level from steroid therapy. C. Restrict the dietary intake of foods high in potassium. D. Note any change in the color and consistency of stools. Question 31. Answer: A. Replace lost fluid and sodium. Question 31. Explanation: Diarrhea. D. T. An acute episode of ulcerative colitis leads to fluid and electrolyte losses, so fluid replacement takes priority. Question 32. A 29-years-old patient has an acute episode of ulcerative colitis. What diagnostic test confirms this diagnosis? A. Barium swallow. B. Stool examination. C. Gastric analysis. D. Sigmoidoscopy. Question 32. Answer: D. Sigmoidoscopy. Question 32. Explanation: Sigmoidoscopy allows direct observation of the colon mucosa for changes, and if needed, biopsy. Question 33. Eleanor, a 62-years-old woman with diverticulosis is your patient. Which interventions would you expect to include in her care? A. Low-fiber diet and fluid restrictions. B. Total parenteral nutrition and bed rest. C. High-fiber diet and administration of psyllium. D. Administration of analgesics and antacids. Question 33. Answer: C. High-fiber diet and administration of psyllium. Question 33. Explanation: She needs a high-fiber diet and a psyllium, bulk laxative, to promote normal soft stools. Question 34. Regina is a 46-years-old woman with ulcerative colitis. You expect her stools to look like: A. Watery and frothy. B. Bloody and mucus. C. Firm and well-formed. D. Alternating constipation and diarrhea. Question 34. Answer: B. Bloody and mucus. Question 34. Explanation: Stools from ulcerative colitis are often bloody and contain mucus. Question 35. Donald is a 61-years-old man with diverticulitis. Diverticulitis is characterized by: A. Periodic rectal hemorrhage. B. Hypertension and tachycardia. C. Vomiting and elevated temperature. D. Crampy and lower left quadrant pain and low-grade fever. Question 35. Answer: D. Crampy and lower left quadrant pain and low-grade fever. Question 35. Explanation: One sign of acute diverticulitis is crampy lower left quadrant pain. A low-grade fever is another common sign. Question 36. Brenda, a 36-years-old patient is on your floor with acute pancreatitis. Treatment for her includes: A. Continuous peritoneal lavage. B. Regular diet with increased fat. C. Nutritional support with TPN. D. Insertion of a T-tube to drain the pancreas. Question 36. Answer: C. Nutritional support with TPN. Question 36. Explanation: With acute pancreatitis, you need to rest the GI tract by TPN as nutritional support. Question 37. Glenda has cholelithiasis, gallstones. You expect her to complain of: A. Pain in the right upper quadrant, radiating to the shoulder. B. Pain in the right lower quadrant, with rebound tenderness. C. Pain in the left upper quadrant, with shortness of breath. D. Pain in the left lower quadrant, with mild cramping. Question 37. Answer: A pain in the right upper quadrant, radiating to the shoulder. Question 37. Explanation: The gallbladder is located in the rear and a frequent sign of gallstones is pain radiating to the shoulder. Question 38. After an abdominal resection for colon cancer, Madeline returns to her room with a Jackson-Pratt drain in place. The purpose of the drain is to: A. Irrigate the incision with a saline solution. B. Prevent bacterial infection of the incision. C. Measure the amount of fluid lost after surgery. D. Prevent accumulation of drainage in the wound. Question 38. Answer: D. Prevent accumulation of drainage in the wound. Question 38. Explanation: A Jackson-Pratt drain promotes wound healing by allowing fluid to escape from the wound. Question 39. Anthony, a 60-years-old patient has just undergone a bowel resection with a colostomy. During the first 24 hours, which of the following observations about the stoma should you report to the doctor? A. Pink color. B. Light edema. C. Small amount of oozing. D. Trickles of bright red blood. Question 39 Answer: D. Trickles of bright red blood. Question 39 Explanation: After creation of a colostomy, expect to see a stoma that is pink, slightly edematous, with some oozing. Bright red blood, regardless of amount, indicates bleeding and should be reported to the doctor. Question 40. You're teaching Anthony how to use his new colostomy. How much skin should remain exposed between the stoma and the ring of the appliance? A. 1/16. B. 1/4. C. 1/2. D. 1. Question 40 Answer: A 1/16. Question 40 Explanation: Only a small amount of skin should be exposed and more than 1/16 of skin allows the excrement to irritate the skin.